Thank you very much, Munir, and thank you very, very much to all of you for coming. This has been a very important journey of partnership between the NIHR's Clinical Research Network and the UK Pharmacogenetics and Stratified Medicine Network. And I want to thank Munir and Christine and all of the team, including many of the board members. I think some of you are here today in that process, because obviously that network has enormous experience of trying to support and develop and also deliver stratified medicine studies. And obviously, as an NIHR CRN community, we are also therefore very strongly focused on delivering key studies that will change the outcomes for patients across the NHS. But it was identified perhaps as far back as 2016, and there's a position paper at that point, that there were some good things happening within the CRN for delivery, but there were some obstacles for that. And so therefore, 2 years ago, we had a workshop here, which Munir has mentioned, trying to address that, trying to understand the key issues that we needed to unblock or find solutions for. And that I'll summarize very briefly. But today is very much focused then about how we deliver stratified medicines within the NHS. And that process was about also developing a community who can help in the leadership and in the direction of how we deliver that. So obviously there is the stratified medicine community, and some of you will be representing that today. But then we identified that within each of the CRN's national specialties, we needed to identify people who could become champions of stratified medicine studies, but also learn and be aware of support and infrastructure and processes that could facilitate that. And then within the local clinical research networks, the LCRNs, equally where their specific focus is on delivering to the NHS trusts and organisations within their patch, having a facilitator, somebody who could foster that, support that, drive that forward with the rest of the team was important. And you're there, you're all here today, or some of you as representatives are there for that. So today is a workshop. We're going to try and then, in a way, update and hand over to you all some of the points that we've arrived at and some of the next steps that we want you to help us in taking forward. And just to say that 10 days ago, as the specialty cluster hub that's been doing this across all of the national specialties on behalf of the whole of the NIHR CRN, we handed over, in a sense, back to the CRN executive where we'd got to, the key outputs, the key next steps, including today. And therefore we will continue to work with all of the national specialty clusters and LCRNs and the executive in implementing that. I want to thank also Vanessa Pausty, who's my assistant cluster lead, who's co-led this process, our team here, Ian, Leslie, who was on reception, but also members of the project board. So that's a number of people from within NIHR, but also from the StratMed community, all of whom have helped in us getting to this point. So what I will do is just very, very briefly, just give you the shape of what arose from the workshop 2 years ago. Today we're going to be then focusing in on 3 or 4 specific areas that we feel that you as a community are well placed to help take forward. And then we're going to have some illustrations, some examples of where stratified medicine studies are being delivered, some of the challenges, some of the experiences of trying to engage with the NHS for that. And then before lunch, we'll start in the specific breakout groups. So this was the roadmap that we tried to develop through this workshop process. And actually, we tried to then summarize from this joint workshop back in November where were the key domains, the key areas that we needed to focus on. And very cleverly, they came up with an acronym of DELIVER, which is therefore helping us focus. This is about delivering stratified medicine studies. And each of these areas, design, engagement, leadership, innovation, value, empowerment and recognition, were identified as areas that we needed to focus on. There were areas that we needed to try and find solutions to help us go forward. There isn't time today to go into all the detail of all of them, and there is a summary report of that which you have just in 3 pages, but there's a much longer document that we've submitted to the CRN executive, and in due course will also be published. And then, as Munir's pointed out, we have a publication submitted to a scientific journal that will summarise this as well. But just to give you some illustrations of what that meant. So one area was about designing studies that were suited for stratified medicine. And obviously that's something that this community can inform and influence and be involved in, but it also is something that very much involves many of our other external partners within the stratified medicine community. So today is a little bit about that, is about how we engage our communities to ensure that as we design and develop stratified medicine studies, they're able to be delivered within the NHS, not just that they're beautiful studies, but they're deliverable studies, and how do we deliver those studies. But there are other factors that are important in that pipeline. So, for example, the StratMed network has had a series of workshops, including, for example, this from the MHRA, in terms of understanding the framework for which stratified medicine studies need to deliver. I guess empowerment was identified as something that was incredibly important. So many people perhaps are aware of stratified medicine studies, they know some elements of that, but how can we empower the community to be far more informed, or where needed, be informed about what stratified medicine studies meant, what they involved, what were things to look out for, what were things that they needed to think about, both in terms of developing and delivering. And we'll come on to that in a minute, because a lot of that is about the champions and facilitators, of which many of you are here today. But it was also providing a resource. So we've provided there both specific resources, some learning tools that will provide information that's easily accessible on aspects of delivering stratified medicine studies. But it's also a point that will allow connection with existing resources, because we've definitely not wanted to reinvent any wheels. And there's a lot of information also provided by the UK Pharmacogenetic Stratified Medicine Network itself, but also from MRC and many other stakeholders. So that's important. It's there. It's an evolving website, but it, I think, is an important point that it will be helpful for you as champions and facilitators to be aware of, and equally for the external partners. If there are links or opportunities to enhance that, then do let us know during the day. I guess this is what today is about, and it was identified that there are many people involved in stratified medicine studies, but we needed to develop a community that was informed and that could share in the leadership of taking that forward, both across the 30 national specialties and then also within the LCRN structures, and also obviously in partnership with the devolved nation infrastructures. So that's what emerged, and I'm very grateful to each of you who have any of these roles for stepping forward on behalf of your communities in doing that. Welcome, do come in. And importantly, as for those unfamiliar, there are 30 national specialties supporting studies across the country. So far we've got 29 named stratified medicine champions. Not all of them are here, but many of you are. And then we've identified or are identifying stratified medicine facilitators. So that together provides a much bigger specialty-focused and local network-focused community. And it's not often that those communities necessarily link up, certainly at a national level. And today is a bit about that linkage, is about how together we can work to deliver these studies. So some of that was then focused in some of the areas that we then needed to specifically work on. And in the area of innovation, there were a number of different areas, points that arose. One very practical thing, which still remains a challenge, is perceptions of how, for example, the CRN funding structures allow or may make complicated the delivery of stratified medicine studies. And whilst our project hasn't necessarily fully resolved that, a lot of it was about external perceptions, about things that not necessarily are present, but where there are solutions. And some of that in terms of recommending and improving the external perceptions of how the CRN delivers or supports studies was identified. But I think this is also something that was very interesting, actually, and we perceived that we perhaps needed specific guidance on the challenges of delivering stratified medicine studies, because the community felt that they perhaps were so special or so unique or so challenging that actually we needed particular guidance. And what was interesting, we had a series of workshops and consultations with stakeholders, particularly led by the local clinical research network community itself, and Jackie Mohammed was very involved in helping with this. But what emerged was actually stratified medicine studies are complex studies, but they're like any study that's complex. There are solutions to that. And actually, rather than saying stratified medicine is so strange, it was trying to address how we deliver complex studies. And indeed, this document, which was developed and then has now actually been started to be implemented, provides a framework which not only is useful for the stratified medicine community, but other communities or other types of studies are beginning to use this, including, for example, studies run through general practice, etc. And Phil Evans, not sure if he's arrived here, has been very important in helping us with that. So this is a resource that's available, that's useful, that's a growing document that can evolve. So this is quite interesting. What was clear was that if we say, okay, we're going to try and target and focus on improving delivery of stratified medicine studies, which are the stratified medicine studies in our portfolio? And there was no easy way of doing that. In fact, the definition of what a stratified medicine study varied, whether you were coming from an MRC perspective or a Department of Health perspective or an NIHR perspective. And actually the process of being able to say this is a stratified medicine study has required quite a lot of work in evolving that. We took a position on that, which was to take the definition of the Department of Health, but recognise that actually there were other definitions that were available. And what we've tried to do is to develop a decision tree so that people can say, well, actually, these are the elements that characterize a stratified medicine study. But remember, a stratified medicine study for cancer or for a very rare disease with a genetic marker may be very different across different specialties that perhaps do or don't have the benefit of those specific markers at this stage. What we've concluded here is actually it's probably important for the chief investigator themselves to say, hey, I think this is a stratified medicine study. But then behind the scenes, there's also a mechanism to both verify that, if people haven't identified it, to identify that. And we've also escalated this also to see, and actually as people register new studies, they can say, this is a stratified medicine study. So this is ongoing work, but is important then when we get on to performance managing and reporting that. You know, are we learning? Are we getting better? Are we improving? Can we track those studies and give some targeted focus of them? Again, I'll just go through these quite quickly, but engagement was felt to be incredibly important, particularly patient and public involvement engagement. That, I guess, is still some work in progress, and this is something that we've handed on very strongly to the executive and the directorate in CRN to take forward, because it's very important. There are lots of initiatives in this area. We need to kind of bring some of those together, both from specialty perspective, local perspectives, and from the UK Stratified Medicine Network itself. But certainly the recommendation is that there needs to be some ongoing work to pull that together, which the CRN executive are going to take forward. Again, just perhaps more briefly now, there was a recognition that we do have some fantastic examples of delivering stratified medicine studies within the CRN, and actually having those exemplars available is helpful for people in developing new studies, and there are some of those which we've identified we can add to that. And today we're just going to hear a couple of examples as illustration of that. But again, this is a resource that can be available, and if you have good examples, do let us know. So where we've got to is that this project focused on stratified medicine has been something that our cluster has been particularly focusing on across all of the clusters. So I've been working with the National Specialty Cluster leads for all of the 30 specialties. There are 6 cluster hubs, and equally with the medical directorate and therefore the clinical directors of the 15 specialties. Some of this work is ongoing, which we'll take forward. Some of it is plugging it into business as usual of the CRN, and that's obviously therefore involving and working with you therefore as specialty stratified medicine champions and facilitators, and the directorate and the executives the executive and the directorates of the CRN. It's continuing to work very closely with the StratMed community, therefore Munir's network and all of those of you who are representing that here today. We have made these recommendations and there is an agreed implementation program associated with those. But today is therefore about taking those areas forward with you and focusing on some areas that we think emerging from this are particularly important. And we'll go into that in more detail as we introduce the breakout sessions. So that's a kind of overview of a lot of work over 2 years of trying to understand where the key challenges are. Behind each of those points, there's a summary of a lot of work that's happened. And on the working tables later, there'll be facilitators who will be able to provide some of that detail if it's useful. But also, it's much now is about how we engage with our communities locally and across our national specialties, and that will be the particular focus of the rest of the day.